Hello, good afternoon to everyone. I am Elango from Trichy. This is the video for the nursing students in our Tamil Nadu state. So today's topic is about the positioning. The positioning is important for the nurses and doctors to commit the nursing intervention. So keeping the patient's position is nurse's hand. So each and every position has got their own speculations and importance. So let's see about the different positions for the different interventions. This is called supine position. What you have seen in the in front of you is the supine position. In this position, the patient is lying down on the back on the bed, and legs are straight, both hands are straight, and the patient seeing the roof. So this is the position important for the liver biopsy cases, and post myelogram procedures also you should keep the patient in this position. And also you can examine the patient and you can talk to the patient in this supine position. This is almost anatomical position on the bed that you can perform a few nursing intervention. The next slide is actually says about the prone position. This is just opposite to the supine position that you can see on the picture. This is this position for amputation of lower extremity patient, for the unconscious patients, to promote the drainage if you keep the chest drainage. The very important is you should keep a pillow under the head, and another pillow, just a small size of pillow under the abdomen, and another pillow near the foot. So these are all the places that rest on the bed for a long time to give the better comfort. So you should give the adequate pillow in this prone position. This is the third position, that is right lateral position actually. So you should use, a nurse should use adequate pillows in different places to avoid the pressure. So one is under the head, and you can instruct the patient to keep the hand on the pillow, especially the left hand. The right hand should be supported by another pillow, and you should give in between the armpit. Another pillow for the left leg, and the leg should be slightly flexed, and the right leg should be straight. This is the right lateral position for the case those who wants to under liver biopsy, hemorrhoidectomy cases, and after the enema you should keep the patient in this position for the better effectiveness. So at the time of enema, you should give the left lateral position. After the enema, this is the right lateral position to better action. Let's go to the next slide. This is actually the Sims position. Okay, do you understand this? This is called Sims position. In this Sims position, the patient is lying down in the left lateral, and slightly the left leg is straight and right leg is slightly flexed. The left arm is just behind the thorax, and the right arm is flexed nearby face. And only one pillow you can give it for the head, and this is the position for the rectal enema, irrigations, and this is a better position for the pregnant woman to sleep. So this is called Sims position. All right, yeah. So this is another type of position, says about knee chest position, otherwise known as genupectoral position. This is the position very useful for the gynecological and obstetrical examinations of patients with pregnancy or without pregnancy. So this is called knee chest position or genupectoral position. Okay, this is about dorsal recommend position. This position, you just see the picture, the both legs are flexed, the knee joint is flexed, the foot or the both foot are on the bed, the both hands are raised above the head, and this is almost relaxed position. The abdominal muscles also relaxed. You can keep this position for the patient with the forceps delivery, or sometimes you can do some vaginal examination for the patient. This is called dorsal recommend position. Okay, this is about the Fowler's position. Exactly, this is 90 degree of Fowler's position. As an upright position, you can say, and you can watch the foot with a foot rest. Okay, it should not be, the patient should not be slipped down. In order to prevent that, you should keep the foot rest to give the better support for the foot, and also to prevent the foot drop. And another instruction for the nurses, the nurses should keep the sandbag or any cushions just behind the both knee joints in order to avoid stretch. And this is 90 degree Fowler's position for the case with the laryngectomy, thoracocentesis cases, autonomic dysreflexia cases, cataract surgery posted cases, and craniotomy cases. Also, you should keep it in this position. This gives better position for those many cases. So in this Fowler's position, there are different types. This is 90 degree. You can keep sometimes with the 60 to 45 degree, and sometimes low Fowler's with the 15 degree angulations. Also, you can keep it for the better breathe. This is called Fowler's position. This is about the lithotomy position. This is the position for genital tract surgeries, vaginal deliveries, and also you can perform some hysterectomy in the operation theater. As a special devices, it is an automatic hydraulic table that you can keep it for the lithotomy position. For every lithotomy position, the legs so much, the patient feels so much of pain in the legs and hip joints. So in order to prevent that, you should keep the lithotomy rod, lithotomy cushions, and also the arm board. The both hands are rested on the arm board that you can see in this position, and the legs are fully supported by the lithotomy rod and lithotomy cushions. So you can expand the legs for according to your procedure, and you can keep some Macintosh just under the buttocks, and you can give the genital tract wash directly. That Macintosh goes into the bucket to give a better wash because the cushion setup is down. So you can attend the patient very well for the genital tract surgeries in this lithotomy position. Areas prone for pressure ulcer is, these are all the places in the left lateral position, especially the edges of the ear, shoulder, elbow, the hip joints, heels, and ankles are in the left lateral position, the common places for the pressure ulcer. In this supine position, you can say that head, shoulders, elbow, buttock, heel, and toes are more common for the decubitus ulcer. This is actually semi-Fowler's position here. For a long time, if you keep the patient in the same position for a long time, the patient might have pressure ulcer in the backside of the head, especially the occipital region. Then the patient have shoulder ulcer, sacral ulcer, buttocks also give so much of pressure, and that gives some pressure ulcer. And the heel, prolonged time of keeping the patient in the same position, the heel might have decubitus ulcer. In this Fowler's position, these are all the important places to get more common for decubitus ulcer. This is actually a prone position. If you keep the patient in the prone position for a long time, the patient's elbow may have ulcer, the chin, chest, especially the reproductive organs, the knee joint, and toes are the common places to get the ulcer. So in order to avoid these many things, the nurses should be very, very careful to keep the patient and to change the position and to give the better comfort to the patients. Better use some cushions, pillows adequately in order to prevent the pressure ulcer. And take care of your patient. Meanwhile, if you want to contact me, you can contact through email and phone number. Thank you for watching. Bye bye.